Dear viewers, well-being, health, wellness are things that are essential for us to be happy. There is no use of having everything and not having the necessary health, which is the most important wealth. We know about allopathy, we know about Ayurveda, but we also know about homeopathy. But how does homeopathy work? And is it a reliable form of medication? To speak about all that, I with me, Dr. Rajesh. Warm welcome to the show.
Thank you.
You've been a homeopathy practitioner for quite some time now.
Yeah, around 15 years.
Yeah, and your claim to fame has been that you've been treating some very specific diseases, not just giving medication for cough, fever, and cold.
Yeah, nowadays ailments are more, so we try to treat all types of diseases.
Okay.
Basically, homeopathy works very well in rheumatism, asthma, skin ailments, and other chronic diseases.
Okay. Originally, when homeopathy came into existence, basically, and also after that, though homeopathy actually claimed that it could cure almost any disease, if at all there was a symptom, there was a cure for it, right?
Right.
But later on, these smaller practitioners started giving medicine mostly for fever, cold, and such what you can actually call as domestic ailments. Do you think so?
Yeah, basically homeopathy has medicines for all types of ailments.
Okay.
It is after the popularity of homeopathy now, so people try to rely on all the diseases. For example, right from a simple cold and cough to cancer, they depend upon homeopathy.
Okay, but you can see definite results in case of cold and cough and toothache and stomachache. And
yeah, see, these are acute cases.
Things like that. Yes.
See, these are acute cases. Especially in chronic cases, it takes its own time. And by the time a general patient comes to a homeopathic doctor, it would have modified itself. So we try to take the case sheet and then try to find out what exactly is the cause of the disease.
But it's not sufficient like in allopathy that you know where the disease is and what needs to be done about it. But in your case, you need to study the person also. You just study a lot of other symptoms, because you cannot just cure that particular symptom. You need to study the conditions to the mental makeup to everything. So you could actually make a mistake in that.
No,
and
not
sometimes the medicines are very specific, because there could be two ailments but with a little difference in symptoms, and unless you actually study the symptoms entirely, you will not be able to give the right medicine.
Yeah, I agree with you. So that's why we form a complete case history and then try to ascertain what is wrong with him. There are so many factors contributing. Let it be environmental pollution, stress and tension, and of course certain times side effects of allopathic medicines also that would have modified the disease itself when they come to a homeopathic doctor. And most of the patients generally come to us for a last resort. So you can't expect a
when everything else has failed.
You can't expect an overnight result.
Okay, but also homeopathy takes a very long time to start showing results. Is that one of the reasons a lot of people do not go to homeopaths?
No, not necessarily. We need to convince the patient regarding the efficacy of homeopathy, and it depends from person to person. For example, a person with the same complaint gets a cure within 15 days, but the same condition, it might take 6 months for another patient. So you can't exactly give a time factor for everything.
Something called the reception, because some bodies respond to homeopathy better than some other bodies.
Yes,
that is something a lot of people have noticed. Some people are very receptive to the medication.
Definitely, I have observed in my practice.
Okay.
You close your eyes and give medicine, it will definitely work in certain patients, but you bog your mind for 3 days on a single case and then give the best of best medicine, still sometimes it doesn't work.
Because in some cases it's very psychosomatic also, particularly in the case of homeopathy medicine. Because the kind of medication that you're talking about, it is like, almost in atoms in some case, you're talking about molecules.
Yeah, we call it as potentization of the medicine.
But the actual amount of medicine in the sugar pill could be as negligible as atomic.
Yeah, you can't show it in a electron microscope also. But basically, we try to target the vital force which is inside you to bring about the changes. So when the vital force in your body has been disturbed, then you get diseases.
So would it be possible that, if somebody is already in a position to accept this medicine as a possible form of cure, that it may actually start acting better?
Yes, definitely.
So the person has to trust in the doctor.
Yes. So you can't visit a temple without a trust in the God.
Okay.
So same way you have to come to a homeopathic doctor, trusting the system as well as the doctor.
Okay, because the body needs to actually accept the medicine,
Right.
to be able to get the benefit of it.
Right.
And particularly because all these sugar pills, they all look so simple, and though you put these things and the medicines
But
and all that.
the making of the medicine is a very, very tedious process, I tell you.
Okay.
Even today, most of the medicines are imported from Germany, and so many doctors as well doesn't know the correct know how it is made, basically.
Okay. But there has been a lot of argument against homeopathy medicine also, because saying that, how is it actually possible for these medicines to work when you dilute it to such an extent, in some of the cases, the medicine may not even reach those sugar pills?
No, basically, see, you should rely on the result.
Okay.
See, when you are giving the result, why you want to bother too much about the efficacy of the system?
Okay.
Without that, the public won't accept.
When a thing that actually causes that kind of a symptom can actually cure a disease with that kind of a symptom, how is it possible the same thing, when it's diluted to such proportion, can actually cure it better?
Yes. Yeah, so we are talking about similia similibus curantur, that is like cures like. So when a substance can produce certain amount of symptoms, it has got the property to cure the same type of symptoms. That's why we call it as a drug pitcher. So almost all the substances in this world, let it be poisons, let it be minerals, let it be chemicals, let it be simple herbs, we have got a drug pitcher where it is proven on a healthy human being. He produces certain symptoms of the medicine, okay, what we give. So same set of symptoms when we see in the clinic, we try to give the same medicine.
Okay. But in case of Hahnemann himself, he was a medical doctor, then he became a homeopath. But why are the current or the present day homeopaths not actually going to allopathy medicine first and studying it entirely and then becoming homeopaths, instead of directly becoming homeopaths?
No, that of course was there previously. Now we have got our homeopathic colleges. It's as full term as an MBBS doctor studying 5.5 years. We also study the same.
But what do you study there?
We have anatomy, physiology,
okay.
All the subjects with
you
them.
do dissections also?
Yeah, basically in anatomy we do that. We do that in the first year itself.
Okay.
And then we come to know about the human being, and then we go into details. But it's a different subject. See, we try to study all these an allopathic doctor studies. Apart from that, we have homeopathic subjects.
Okay. But the most curious thing is that some of the most educated people, knowledgeable people, and in some cases even allopathic doctors themselves come to a homeopath. Why?
See, they might not send their patients, but they definitely come for themselves and their family.
Yes.
Even I myself.
I've seen it myself.
Yeah, I myself
cases.
have might be about 200 to 300 doctors as my patients.
Okay.
But the thing is, see, we give results.
Okay. And also because you have very few side effects.
That is true.
To be precise, homeopathy medicines don't produce any kinds of side effects at all. But it's very surprising. For instance, cyanide can actually kill even if a molecule gets in.
Right.
But you're using cyanide also.
See,
but how is it possible?
Basically, you said you can't even show a molecule. But it has observed the good properties of cyanide.
Okay.
And the symptoms what cyanide can produce, when we give on a healthy human being, he has breathlessness, anxiety, and other related symptoms of an cyanide poisoning. But when it is given in a medicinal form, the same patients with restlessness and breathlessness, he might calm down.
Otherwise, it used to be always aconite, bryonia, calendula lotion and all that. But now you have all kinds of medicines, right?
Right.
So are you trying to say that, presently that, there has been so much research in this field that you brought in more medicines
definitely.
into homeopathy?
Yeah, the day-to-day medicines are adding up. and day-to-day diseases are also adding up. So we try to form a, not that aconite brain is not working today, it is definitely working, but along with that there are other combinations also we generally try out.
Today the most important thing is combination medicine.
Right.
Unlike before, like you used to give a particular medicine, now you know you mix and match and try to see what works the best.
Right, right. See, basically any system for it to grow, we need to do some type of a research. I believe in that. See, we can't stick on to what Hahnemann found out about 250 or 300 years back. We as doctors, we have our own research centers. Every clinic is a research center for us. So we basically try to form out different type of combinations and try to work out, see that the result is first.
Okay. These days, most of the homeopaths are into giving. These days, most of the homeopaths are into giving fertility medicines. So, is it because it's more attractive and can earn more money for the practitioner?
No, not necessarily. We don't take more money for a pregnancy case or let it be a simple cold. Our basic charges will remain the same. Thing is, see, people come to homeopathy for fertility because we try to treat the cause of the disease.
Okay.
For example, let it be a PCOD problem, let it be a tubal block, let it be a endometrial thickness. See, these are all physiological changes what a lady might be having.
Okay.
But there are certain factors before that. See, why she is not getting pregnant.
Okay.
Might be something inhibiting factor is there when she was growing or maturing. All those things we take into consideration.
Okay. These blockages in any kind of tubes, including stones in the kidney, are something that you are quite skilled in treating, right? How come?
See, basically when certain things are forming in the body, there should be some physiological changes. When a stone is forming in your liver or, for example, gallbladder or in your kidney, there is some changes in the normal secretions of your bile or in your kidney. So that's why that stone try to form. So we try to separate the system by seeing that the normal secretion takes place and the stone is evacuated.
Okay, but you have had miraculous results also in some cases, like
right.
So the very big stones got ejected.
Right.
Right? So, and the patients were quite happy.
Right.
And if it's actually possible that way, why don't you actually reach out to more people instead of people going for operations and spending so much money and ultimately not even finding solutions? They can actually come to homeopathy,
Yeah,
right?
basically, right. Yeah, what happens is, see, in homeopathy, we don't try to popularize it like in allopathy or something like that. See, it's only through mouth to mouth it is spreading.
And there's also
now.
a certain amount of hesitation in these doctors. Is it because somewhere you people don't believe in your science yourselves so much?
No, nowadays I think most of the doctors are very busy.
Oh.
And, probably that is also a factor.
Okay.
And we have to reach out. See, there's nothing that we have to keep everything in our house. So we have to be more open and we have to tell the general public how it works. And we have to encourage more questions about homeopathy. Then only
it's
we can
actually
answer.
not uneducated people trying out this alternate medication, but if somebody comes to your own clinic, you see a lot of well-settled people sitting there and waiting for you for hours.
Yeah, that is the saddest part. Basically, we are not able to reach out to the poorer section.
And because this is also not expensive at all,
Yes,
I think
yes.
this is something that should reach the common man or even a poor man, because nowadays you know how expensive it is to buy a cough syrup, to any kind of antibiotics, to anything. And I think for that they can get the whole treatment, because you charge something 50 rupees to 100 rupees, which is like absolutely okay.
Right. Basically, see, the poorer section definitely has to come to homeopathy because we can give a better result to them. And that's what we are trying to popularize homeopathy in rural areas also.
So you say the proof of homeopathy is in the cure that you can give?
Yes,
or
definitely.
Bring about?
Definitely we can do that.
Okay, it's more about, you cannot find it out in terms of tests or whatever, but you certainly rely on tests, right? These days you also get reports, you study those reports and all that.
Yeah, sometime back we were telling about gallstones or kidney stones for that matter. How do you know? So basically you have to get a scan done, then only we come to know.
Okay, then won't people say that homeopaths are actually pretending to be allopaths?
No, not
at least trying to convince patients to have a better faith in them?
Yeah, that is definitely there. See, everybody wants proof now.
Okay.
So we have to find out some type of a proof for them that the medicines are working.
Okay.
So we are answerable.
Do you actually do something like a before and after? So that
not necessarily in all the cases.
New patients actually believe in it, like, this was what it was before. About this hair fall treatment also, a lot of people have tried it, and some of them, do all these things and ultimately say before and after, even if it's not worked.
Yeah, sometimes it might be in the reverse process also. Yeah. So not necessarily.
But there is also a danger of it, isn't it?
Yeah. Okay. So too much popularizing is also dangerous for any system for that matter. And every doctor should know his restrictions and his limitations.
To a very great extent, some time ago, in the sense maybe even about 30 years ago, people indulged in a lot of self-medication when it came to homeopathy, right? But nowadays people don't try it. People actually go to homeopaths.
Right.
So if they need homeopathic treatment.
That time qualified doctors were very less. So people used to try, they used to study their books and then try certain medicines on themselves and their family and friends. Okay. But now you can find...
Because you had this ready reckoners, I tell you, for homeopathic medicines, and even the medicines were available.
Easily available also, right.
And now the potency is the most important thing. That's one thing, like, only a good doctor can advise the right potency.
Right. First, you have to come to the correct medicine, and then second thing is finding out the correct potency.
It's not always the highest potency. It could also be a medicine of a lower potency.
Generally, lower potency works better.
Yeah, why is it so?
But see,
is it because the concentration is more there?
Yeah, the dilutions part, as the potency increases, the dilution also increases.
Yes.
Sometimes in lower potencies, the amount of medicine will be little more than in a higher potency. So it works generally well.
Okay. Then why do you actually give medicine of higher potency?
See, if you are very much sure and if any recurrence is there, then we try to give a higher potency, and it depends upon the miasm also. So we come into miasms like psora, syphilic and psychotic miasms. So depending upon that also we give lower higher potency. For example, acute case might need a lower potency, whereas a chronic disease might need a higher potency.
Okay, but it used to be quite different once again about 2 to 3 decades ago. People are quite afraid of homeopathy medicine because of the dieting. But nowadays you don't even talk about it, because once upon a time it was like, if you were taking homeopathy medicine, that you had to avoid onions and garlic and coffee, tea and all that. But nowadays you don't even suggest anything like that. So it's better to take homeopathy medicine these days, because it's like
generally absolutely. If you give a time gap for about half an hour, 1 hour before taking any food, medicines works excellently well, and even if you take half an hour after or 1 hour after your food also, it works very well. So absolutely there's no need of much diet restrictions. Sometimes when it is inhibiting the action of the medicine, then only we sometimes restrict.
Okay, but what about strong smells that are kept around this medicine? That's one of the things that don't keep it in a place where some substances emanating a very strong smell that could interfere in the medicine.
Yeah, that also is there. It can spoil the concentration. As you said, our medicines are very minute, potentized medicines. Sometimes strong smelling drugs or other scents or something like that, if you kept beside that, then it might not work well.
Why does mood play such an important role in homeopathy medicine?
Yeah, basically we try to concentrate on the mind. See, if the mind is good, then the whole health of the person will be good. So any changes, for example, stress, tension, anxiety, factors which are contributing, definitely affects the disease of the person. And the efficacy of the medicine also sometimes. If you are saying homeopathic medicine is sometimes not effective, a maintaining factor is there, like stress, tension, anxiety, or environmental factor, pollution. So many other factors contribute to it.
But you also try to study the mood of the person, the mental makeup of the person.
Yeah, we give more importance to that, because for any changes to happen in a human being, the mind is one thing. You are telling about women not getting pregnant. Might be some type of a stress, tension. Might be her in-laws are giving a little bit tension. So it's a natural inhibitor. See, when yourself you are not able to look after your well, how can you take care of a child? So it's a natural inhibitor.
Okay. Is it also possible that, there could be some other factor, some physiological, some chemical, some hormonal factor that you may not even come to know about, and you could be giving some medicine and the medicine may not be working at all?
Yeah, it generally happens. See, for anything like normal hormones to be secreted also, your mind should be good. Your pituitary gland is just in the base of your brain. So now the brain has taken over everything, and the hormonal changes are less important in a human being when compared to the brain.
Okay.
So these factors generally play a role.
Okay. But when you give a medicine, I mean, do you actually give because you're 100% sure it's going to cure, or, the first time you give because, you think that maybe it will work? And
No.
I'll wait for the result and then see then whether I have to improve on it or, change the medicine or whatever, because, unlike in allopathy medicine, because, it directly acts, because you're here also taking care of the whole body, because you just don't want the ailment to subside, but also you want even the cause to go away.
Yes, the trial and error method has already gone.
Okay.
So we are very much sure what we are giving, and we accept a result within a week's time.
But you also use computers these days. Every time you give medicine, you also look what you're given before.
See, that is only a progress. See, what happens is, you are not able to maintain records nowadays. See, a computer can store about, I've got about 30,000-40,000 patients. How can you store it? You need a big room.
Okay.
So you can't store it in writings. So we store it in computer.
So is it also better for you to look at, the history?
Yes.
So that you see that, how the person has been responding, what has happened. Have you ever seen some cases where the medicine has adversely affected? Because, once upon a time it was like when you took homeopathy medicine, it would aggravate the disease. Was it a myth, or did it actually work that way? See, for a very long time, they say first it would aggravate and then it would cure. But now you're not talking about it.
Yeah, it's not. It's again a wrong notion that generally when you're giving the right medicine, the disease aggravates and then comes.
Okay, only then you know whether it's actually working or not and all that.
So that's how sometimes a higher potency might sometimes aggravate a case, but not necessarily. But even if the symptoms are aggravating, the patient will definitely feel better. Okay. And sometimes it's a good symptoms, we call it as, but you can't explain it to the general public. See, they want result immediately. You can't expect an aggravation to happen, then an amelioration to happen.
In most cases, people come to you only after the allopath would have failed. But you actually say that why don't you come to us first before you go to anybody else? Because, for instance, if it's an abscess or anything, you say come in the first stage itself, so we can actually do something about it, instead of coming when we can't do anything, when it actually requires surgery. Because there have been some cases where you have definitely told people that they need to go for surgery because you cannot do anything about it, right?
Yeah. So that's how you said now more educated people come to homeopathy.
Okay.
They know precisely which system works best for their disease condition.
At what level, at what stage?
Levels. Yeah.
Okay.
And they are very much educated, and they understand the system very well. So they come as a first priority for homeopathy in a lot of diseases.
But they need to go to the right person. That's the most important
that
thing.
Definitely they can find.
Not waste time by going to a wrong person and ultimately end up with a bigger disease.
No, if they are coming to a qualified homeopathic doctor, I think he can definitely do the justice.
Okay. You're a postgraduate, aren't you?
Yeah, basically, yes.
Okay. And is there any difference between somebody who has just studied a bachelor's course in homeopathy to somebody who has done post-graduation, or is it just to do with, you can treat more diseases?
No,
or
not necessarily.
Ultimately, the most important thing is that you have more experience, that you've seen more patients.
Yeah, that ultimately matters in homeopathy.
Okay.
The more experience.
Because there are some ordinary doctors who are better practitioners because after having seen how the medicine works with different people, they could have decided better.
Experience plays a role. See, to set up my practice, I have taken 15 years. So it's only an experience. More than your education, you need to deal with your patients every day. Then only you get a better experience rather than your education. Of course, basic education should be there, but your experience and your concentration, everything matters.
If somebody says homeopathy is such a fine science, whether people believe in it or not, it certainly works. But maybe, or rather perhaps, a homeopath should not claim to cure all diseases. That's where they go wrong. They should know their limitation. They should say, look, these things we can do. If they say we'll cure that, this and wherever, and you start failing and people lose faith in you.
I hope we don't reach that stage, but as a physicians, we know what is the limitation of our system. We don't claim. So many times we send back with a heavy heart that it is not possible through homeopathy. That has happened, generally happens. And we should know our limitations, and we should not claim that we can treat everything.
Sometimes there's a lot of frustration also, because you keep trying for a very, very long time and no result at all.
No, might be the patient gets frustrated, but as a physician, we generally give them hope, and we also hope that it.
But you certainly believe in your system very much.
Yes, yes.
But what is the state today of homeopathy medicine all over the world? Is it only that in India that you are getting acceptance?
No, homeopathy has grown all over the world. It has come from Europe. Even in Europe, it has made a big name. In WHO, it is recognized as the second largest alternative medicine, next to allopathy. And now WHO has special programs to promote homeopathy, especially in other countries, especially in African countries and in American countries for that matter.
Okay.
But as you say, there also only a section of people come to homeopathy. Those who are educated in homeopathy generally try out homeopathy.
Okay, because you know they actually can believe in those small sugar pills.
Right.
Because some people need to really see those, you know, well-packed capsules and tablets and all, you know. Because as you say, in any case, unless the patient actually feels that he could be cured by a system of medicine, the chance of him getting cured is very remote.
Absolutely right.
So, what has been your greatest success?
See, greatest success is we are able to treat through homeopathy general masses, and we are able to serve the people better with a minimal budget. So our budgets are not high. When we sometimes hear about their stories, how much they have spent, and when they come to us and we give better relief, that itself is a best success, I can say.
So have there been cases where people failed everywhere else and came to you and won in life?
Yeah, those are the patients.
Got a better.
Yeah, those are the patients who have promoted me to this level.
Okay.
And there are so many instances. I should say around 50% of the patients are frustrated with other system and then get results in homeopathy.
Okay. Today, if you are successful, it's because of those patients.
Right, right. Those are the major promoters of homeopathy.
And that's good for you and good for homeopathy too.
Yes. Even today also, that is the best way. Instead of advertising and other things.
Okay, word of mouth is the best thing.
Yes.
And that's why you're on the show.
Right.
Thank you very much, Doctor, for having come to this show.
Welcome, Deepak.